A stroke is a serious medical condition that occurs when the blood supply to part of the brain is interrupted or reduced. This deprives brain tissue of oxygen and nutrients needed to function properly. When this happens, brain cells begin dying within minutes. Strokes are often described as brain attacks, similar to how a heart attack affects the heart. Strokes are unfortunately quite common. According to the World Health Organization, 15 million people suffer from stroke worldwide each year. Of these, 5 million die, and another 5 million are left permanently disabled. In the United States, for example, someone has a stroke every 40 seconds, and every 4 minutes, someone dies of stroke. The risk of having a stroke increases with age, but still strokes can occur at any age. Types of strokes. There are two main types of stroke: ischemic strokes and hemorrhagic strokes. Number 1. Ischemic strokes. Ischemic strokes are the most common, accounting for about 87% of all strokes. They occur when a blood clot blocks a blood vessel supplying blood to part of the brain. This can happen in two ways. First, a clot can form in an artery that's already narrowed by the buildup of fatty deposits, which is a process called atherosclerosis. This is called a thrombotic stroke. Second, a clot can form somewhere else in the body, often in the heart, and travel through the bloodstream to lodge in a brain artery. This is called an embolic stroke. Number 2. Hemorrhagic strokes. Hemorrhagic strokes, on the other hand, occur when a blood vessel in the brain leaks or ruptures. This can happen due to conditions that affect blood vessels, such as uncontrolled high blood pressure, overuse of blood thinners, or weak spots in blood vessel walls called aneurysms. There are two types of hemorrhagic stroke: intracerebral hemorrhage, where bleeding occurs within the brain tissue, and subarachnoid hemorrhage, where bleeding occurs in the space between the brain and the thin tissues that cover it. Other than these two main types, there's also a condition called a transient ischemic attack, TIA, often referred to as a mini stroke. In a TIA, blood flow to part of the brain is blocked for a short time, but the blockage resolves on its own. While a TIA don't cause permanent damage, it's often a warning sign of a future stroke and should be taken very seriously. Causes of strokes. The causes of stroke are varied and complex. For ischemic strokes, which account for the majority of strokes, the main culprit is often atherosclerosis. This is a condition where fatty deposits build up on the inner lining of arteries, causing them to narrow and harden. Over time, these fatty deposits, called plaques, can grow large enough to significantly reduce blood flow through an artery. In some cases, a plaque can rupture, causing a blood clot to form that blocks the artery entirely. High blood pressure, or hypertension, plays a significant role in the development of atherosclerosis. It can damage the inner lining of arteries, making them more susceptible to plaque buildup. Another important cause of ischemic strokes specifically is atrial fibrillation, which is a type of irregular heartbeat. In atrial fibrillation, the upper chambers of the heart beat chaotically and out of sync with the lower chambers or ventricles. This can cause blood to pool in the heart, potentially forming clots. If a clot breaks loose, it can travel to the brain and cause an ischemic stroke. We can't talk about stroke causes without talking about aneurysms, which are a significant cause of hemorrhagic strokes. An aneurysm is a bulge or ballooning in a blood vessel that can leak or rupture, causing bleeding into the brain. Brain aneurysms are caused by thinning artery walls. Most brain aneurysms don't rupture or cause symptoms. However, if an aneurysm ruptures, it causes a hemorrhagic stroke, which can be life-threatening. Certain medications can increase the risk of stroke. Blood thinners, while often prescribed to prevent clots, can increase the risk of hemorrhagic stroke if not carefully monitored. Some illegal drugs, particularly cocaine and methamphetamines, can cause strokes by narrowing blood vessels or triggering sudden spikes in blood pressure. Other than these causes, there are some risk factors for stroke we can't change, like age, family history, and race. For example, the risk of stroke more than doubles each decade after age 55. People with a family history of stroke are at higher risk, and African Americans have a higher risk of stroke than other racial groups in the US. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of stroke. The symptoms of a stroke can vary depending on which part of the brain is affected, but they typically come on suddenly. The most common symptoms can be remembered using the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services. Face drooping means that one side of the face may droop or become numb. The person may have trouble smiling, and their smile may appear uneven. Arm weakness refers to numbness or weakness in one arm. If the person tries to raise both arms, one arm may drift downward. Speech difficulty means the person may have trouble speaking or understanding speech. Their words may be slurred, or they may be unable to speak at all. Other than these obvious symptoms, there are several other important signs to be aware of. Sudden confusion is a common stroke symptom that can manifest in various ways. A person experiencing a stroke might suddenly have trouble understanding what's happening around them. They may struggle to process information or have difficulty with memory. Vision problems are another potential symptom of stroke. These can come on suddenly and affect one or both eyes. Some people experience blurred vision, as if they're looking through a foggy window. Others might have double vision, seeing two images of a single object. A severe headache can be a sign of stroke, particularly in the case of hemorrhagic strokes, where a blood vessel in the brain has ruptured. This isn't just any headache. It's often described as the worst headache of a person's life. The pain can be intense and may come on very suddenly. Other than that, trouble swallowing, medically known as dysphagia, can also occur during a stroke. A person might suddenly find it difficult or painful to swallow. Diagnosis of a stroke. Diagnosing a stroke typically begins with a physical exam and a review of symptoms and medical history. Doctors will check blood pressure, listen to the carotid arteries in the neck, and check for signs of irregular heartbeats. They'll also perform neurological exams to check vision, movement, sensation, reflexes, and understanding. Imaging tests play a crucial role in diagnosing strokes and determining their type and location. A CT scan of the brain is usually one of the first tests done. It can quickly reveal if there's bleeding in the brain. MRI scans provide more detailed images and can detect brain tissue damaged by an ischemic stroke. Treatment for a stroke. Treatment for stroke depends on the type of stroke, how much time has passed since symptoms began, and the part of the brain affected. For ischemic strokes, the goal is to quickly restore blood flow to the brain. This is typically done with a medication called tissue plasminogen activator, TPA, which dissolves blood clots. However, TPA must be given within 4.5 hours of the start of symptoms to be effective. In some cases, doctors may perform a procedure called a mechanical thrombectomy, where they use a device to physically remove the clot from the brain. This can be done up to 24 hours after the stroke in some patients. For hemorrhagic strokes, treatment focuses on controlling the bleeding and reducing pressure in the brain. This may involve medications to lower blood pressure, reverse blood thinning effects, or reduce brain swelling. In some cases, surgery may be necessary to repair the ruptured blood vessel or remove the accumulated blood. After the immediate crisis has passed, stroke treatment shifts to preventing future strokes and addressing any disabilities caused by the stroke. This often involves medications to prevent blood clots, lower blood pressure, or reduce cholesterol. Lifestyle changes, such as quitting smoking, improving diet, and increasing physical activity, are also crucial. Rehabilitation is a key part of stroke recovery. Many stroke survivors experience some degree of disability, which can range from mild to severe. Rehabilitation can include physical therapy to relearn movement and coordination, occupational therapy to regain independence in daily activities, and speech therapy if language or swallowing has been affected. Recovery and prevention. The recovery process after a stroke can be long and challenging. The brain has a remarkable ability to rewire itself, a process called neuroplasticity, which allows undamaged parts of the brain to take over functions from damaged areas. However, this process takes time and effort. Many stroke survivors continue to see improvements for months or even years after their stroke. Prevention is a crucial aspect of stroke management. Many of the risk factors for stroke are modifiable, meaning we can take steps to reduce our risk. This includes controlling blood pressure, quitting smoking, managing diabetes, maintaining a healthy weight, eating a balanced diet, exercising regularly, and limiting alcohol intake. For people who have already had a stroke or TIA, secondary prevention is crucial to reduce the risk of another stroke. This often involves a combination of medications and lifestyle changes tailored to the individual's specific risk factors. Now, we want to hear from you. Did you or someone you know have a stroke before? What was your journey to recovery like? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.